Alright guys, this is me, Jerningham here. I'm going to be filming Matt Hancock's speech. I've forgotten to do it yesterday. And I'm going to do some more speech today, the coronavirus. So this is yesterday's numbers I've forgotten to do. So it's basically 384 yesterday, 1 day ago. It's gone higher, I think today, I don't know. It's a 400 and something. I can't really remember. 410 I think it's today. Anyway, let's play Matt Hancock's video.
Welcome to Downing Street for the daily coronavirus briefing. I'm joined by the Deputy Chief Medical Officer, Jenny Harries, and by NHS England's Medical Director for Primary Care, Dr. Nikki Kanani. First, I want to take this chance to update you on the latest coronavirus data. 2,353,078 tests for coronavirus have now been carried out in the UK, including 133,784 tests yesterday. 236,711 people have tested positive for the virus, an increase of 3,560 since yesterday. 10,024 people are currently in hospital with coronavirus. This is a 13% fall from the same time last week. And very sadly, of those who've tested positive across all settings, 33,998 people have now died. That's an increase of 384 since yesterday, and we mourn each one. The number of deaths is falling each day in all settings, thankfully, and we are past the peak of this virus. And I just want to take a moment to remind everyone about our plans for this second phase. If we can have slide 1, please. We've set up the new COVID alert level system. That's the 5 levels of threat based on the R value and the number of new cases. The alert level in turn guides the social distancing rules, which are vital in our efforts to control the virus. A higher alert level means stricter rules. Throughout the lockdown, we've been at level 4, which means that COVID-19 is in general circulation and transmission is high or rising exponentially. But thanks to your shared sacrifice, we've brought R down. Cautiously and carefully and responsibly, we're now in a position to start moving to level 3. If we could go to the next slide, please. We've set out the first of the 3 steps that we'll take carefully to modify the social distancing rules and start to restore freedom to this country, all the while avoiding a disastrous second peak that could overwhelm the NHS. At each step, we'll closely monitor the impact on R, on the number of new infections, and on, of course, all available data. And we'll only move to the next step when we judge it's safe to do so. In the first step, as of this week, if you work but can't work from home, you should speak to your employer about going back in. People can now spend time outdoors and exercise as often as you like, and you can meet one other person from outside your household in an outdoor public place, but please keep 2 meters apart. This weekend, with the good weather and the new rules, I hope people can enjoy being outside, but please stick with the rules, keep an eye on your family, and don't take risks. Next slide, please. We've also updated what we're asking people to do, which is to stay alert, control the virus, and save lives. For the vast majority of people, staying alert still means staying at home as much as is possible, working from home when you can, limiting contact with people, keeping your distance if you go out, 2 meters, wherever possible. Washing your hands regularly, this is still the single most effective thing that you can do to keep yourself safe. And of course, self-isolating if you or anyone in your household has coronavirus symptoms. By staying alert and following the rules, you can play a part in the national effort, getting R down and keeping R down, controlling the virus so that we can save lives, rebuild livelihoods, and start to recover our freedom as a nation. From the start of this crisis, across the world, because this disease has a bigger impact on the elderly, there's been a huge need to protect people in care homes. We've worked to do this in this country right from the start of the crisis. This morning's information from the ONS once again reminds us that care homes do so much to look after our most vulnerable people in their frailty towards the end of their life. Many of you watching this will have a loved one in a care home, as I do, and I know how worrying it's been. So I want to tell you what we've been doing to protect people in care homes throughout the crisis. If we start with the data, in April, 31,203 people died in care homes, of whom 11,560 died with coronavirus. I'm grateful to the ONS for having responded to the requests to put extra resources into understanding and measuring all this. Right from the start, it's been clear that this horrible virus affects older people most. So right from the start, we've tried to throw a protective ring around our care homes. We set out our first advice in February, and as the virus grew, we strengthened it throughout. We've made sure that care homes have the resources they need to control the spread of infection. Social care is a devolved matter, of course, and this week we've made a further £600 million available to care homes in England. This comes on top of the £3.2 billion we made available in March and April, and the £712 million we made available to the devolved authorities. That's £369 million extra for Scotland, £223 million extra for Wales, and £124 million for Northern Ireland. We've put extra infection control procedures in place and prioritised testing in care homes. We test any resident returning to a care home from hospital and all residents with symptoms and all social care colleagues and members of their households if they have symptoms. Together, these measures have saved lives and protected 64% of care homes, almost 2/3, from having any coronavirus cases at all. And where there are cases, we've taken extra measures to protect residents and staff, with local public health officials playing such a critical role. Now we have capacity for well over 100,000 tests a day. We're extending testing coverage still further. All care home residents and staff in England, both those with symptoms and those without, are now being tested. And in fact, we'll test every resident and every member of staff in our elderly care homes in England between now and early June. To get those tests to where they need to be, we've set up an easy-to-use digital service on gov.uk, allowing care home managers to apply online for the testing kits. Next, we've strengthened the NHS support available to colleagues in social care, and this is what Nikki is here to talk about today. Throughout, the NHS has been supporting care homes with infection control training and advice and support on, for instance, PPE usage. We're putting in place a named clinical lead for every care home in England. These leads are already connected and will check in regularly to assess residents and support care home staff with clinical advice. This is the most intense support and scrutiny that care homes have ever received. In some cases, for residents who need to see a GP, a video consultation may be safer and just as effective. So the NHS is also supporting care homes to introduce the right technology. This same technology can and is being used to be able to help residents stay connected to their loved ones, something I know is important, both for their well-being and for ours. Third, we're making sure local authorities play their part. We're now requiring councils to conduct daily reviews of the situation on the ground in local care homes. These reviews ensure that every care home gets the support they need every single day. And we're requiring care homes to ensure the flow of timely and accurate care home data so local and national government can support and, where necessary, challenge and act if that's what's needed. As a result of all this, and the work of so many people across the social care system and across the NHS and across local government, 2/3 of England's care homes have had no outbreak at all. The number of care homes reporting their first case each day has fallen from a peak of 219 to 59. I'm glad to report that since the peak, the number of COVID-19 deaths of people in care homes has halved. But whilst this is progress, there is so much more to do. And this crisis has also demonstrated the imperative for reform. It's shown the importance of long-standing calls for closer working between health and social care. It's acted as a catalyst for integration and shown the benefits of it on the ground. Information, support and mutual understanding between health and social care are flowing better than ever before, helping to break down some historic barriers, despite the system, not because of it. And my view is that health and social care have a common mission to care for people. But too often in the past, bureaucracy has held them apart. From the start, we've worked incredibly hard to throw that protective ring around our care homes. Yes, it has been difficult. These viruses reserve their full cruelty for those who are physically weakest, the elderly, the frail, and the already sick, all those who most rely on human contact. People who live in care homes are amongst our most vulnerable citizens. We'll do everything humanly possible to protect them for as long as they are threatened by this virus. And thanks to the collective efforts of everyone watching, we have passed through the peak, but there is still a long road ahead. So stay alert, control the virus, and save lives.
Alright guys, it's Jerningham here. Thanks for joining me in this video of Matt Cox's speech. We're going to go into the other one later when there's room on the phone. There's only so much room I can do in this phone. Thank you for joining me. And I'll catch you in the next video. Peace.